Okay. Excessive alcohol intake and psychoactive drugs and chemicals like volatile substances always causes psychological disorder. Nearly 15 to 30% of patients are developing alcohol-related problems and seeking admissions in different kinds of psychiatric hospitals. Okay, we start first with abuse. It is a maladaptive pattern of substance use that impairs our health. Always remember, health is a universal constituent wherein with physical, mental, spiritual, or overall health functions as described by the United Nations. Okay, there are major types of dependence producing drugs which are common in our workplace. Number one is alcohol. The opioids which are usually given to our critically ill in pain patients. Cannabis, which is now as popularly being taken up, either which is illegal or non-legal. The stimulants, sedatives and hypnotics, which are composed of benzodiazepines. Common is nicotine, and sometimes we use hallucinogens. Okay, there are several biological factors affecting substance use. Aside from that, also genetics play a different principle regarding substance use of our clients or our employees in the workplace. And biochemical. There are certain psychological factors, sense of inferiority, or other are low self-esteem, inability to cope with pressures of our living society, loneliness, unmet needs, and sexual immaturity. Okay, the social factors always affects substance use in our workplace. Sometimes for religious reasons, sometimes peer pressure from our bosses or from our colleagues. Then certain urbanizations can always bring about substance use and extended periods of education so that you can cope up with the different problems. And unemployment, secondarily to different factors, overcrowding in one place or in one department, then occupational hazards. Yan, either you are assigned at our security, you are assigned at our wards, you are assigned at the emergency room, or sometimes in our OR. Then, the availability of drugs in your workplace, which can always lead to substance abuse. Okay, psychiatric disorders due to substance abuse. There are several types or several classifications of our substance abuse, wherein common is alcohol dependence, opioid-related disorders, cannabis use, stimulants, LSD, and barbiturates. Okay, consequences which can lead to substance use. Substance use can always leads to physical dependence or psychological dependence or both. It may cause unhealthy lifestyle and behavior such as poor diet. It always impairs our social and occupational functioning, creating personal, professional, financial, and commonly legal problems. Adolescence may lead to emotional and behavioral problems, including depression, family problems with relations, problems with failure to complete school, or chronic substance abuse. In pregnant women or pregnant personnel, substance abuse usually jeopardize the fetal well-being. IV drug abuse may lead to life-threatening complications. Sometimes we get our illegal substances from street drugs, which always poses added dangers. Materials used to dilute them can also cause toxicity or allergic reactions. Okay. As classifications, the number one classification for psychiatric disorders related to substance abuse is acute intoxications, wherein at a certain period of time wherein one ingestion or recent intake can lead to psychological problems when you take the substances as a period in one point or period of time. Remember, when you take the substance, the immediate effect will cause these disorders. But for a period of more than 2 years, you develop dependence syndrome, wherein increased number of your substance use will always be tolerant by your system. Wherein if you just add and add or increase the dosage so that the tolerance or the effect should be achieved. That's why you have dependence syndrome. Then, sudden stoppage of these substances can always lead to withdrawal syndromes, which is sometimes as detrimental to acute intoxication. Sometimes substance can also causes amnestic disorders such as alcohol. And commonly, substance-induced psychotic disorder or psychiatric disorders can lead to either psychotic or mood disorders. Okay, the National Council on Alcoholism and Drug Dependence reports drug and alcohol abuse impacts the workplace in numerous ways, including increased accident and injury rates in one's workplace, sometimes accidents that end in fatalities, common absences, lower productivity of our employees, disciplinary issues, which is a complication, poor co-worker and staff relationship, lower employee morale. Most people try to hide substances and alcohol misuse from their employers and co-workers. However, there are signs to look for if it is suspected someone has problem, including avoidant personality and isolating themselves, blaming their co-workers for mistakes they made, frequently being late to work or leaving early, being absent from work. Then they have declining personal appearance or hygiene. They have complaints of failing relationships at home, taking frequent time off for vague illness just to take the substance. And sometimes our employees smells of alcohol. They are changing moods and behaviors, showing aggression towards co-workers. Consuming alcohol before or during work is a sign of alcohol use disorder. It is greatly impacts productivity and may add pressure and responsibility to your coworkers if they are expected to cover your responsibilities. Always remember, alcohol is a cultural problem, especially in our region. And alcohol use may lead to poor performance at works and may always lead to termination. Some people with alcohol use disorder may consider themselves functional alcoholics and believe that they can perform well at work and continue to drink excessively, which can always lead to denial or acknowledging that their drinking is dangerous, even though at the level of legal or non-legal. If someone drinks immediately after work to unwind and gets irritable if they have to work late, this can be a major concern because we always tackle alcohol as a way of distressing after work. Okay. Opioids. Example for opioids are your pain relievers. The National Safety Council reports 75% of employees state opioid misuse affects their workplace. Opioid misuse impacts workers' compensation with a review of workers' compensation claims showing that 32% of the claimants with prescriptions had at least one opioid prescriptions. Similarly, workers on disability with back injuries with an opioid prescriptions have longer terms of disability. Kaya na mapapansin ninyo, pag nagpapareseta regularly ng mga pain reliever, they have dependency issues for that. Then, they are always looking for the prescription-guided opioids. Other factors such as geographic locations, employee demographics, and size of the company can all contribute to an opioid problem in the workplace. Smaller companies tend to have higher opioid use rates. Older workers hold more opioid prescriptions, especially our geriatric populations or our aging workers in the hospital. Areas with low rates of health insurance coverage had higher opioid prescriptions. And rural health have more workers with prescription opioids than urban areas. Because at this time, these opioid prescriptions are more common in our workplace. How we address the issue? Everyone working in a company must take responsibility when it comes to addressing drugs and alcohol issues by fulfilling their designated jobs. Leaders should always set the tone for what is expected regarding drug and alcohol use in the workplace. Human resources staff communicate what is expected from all their employees. That's why during our orientation, we always tell them regarding hazards in our workplace. They ensure everyone understands the policies relating to their work performance. Supervisors oversee keeping the work environment safe. They must know and abide by policies, directly communicate with the employees, and advocate for employees needing help. The employee is also responsible for understanding law and policies regarding substance misuse and their job performance. Okay, regarding implementation of a substance use policy. Center for Disease Control recommends implementing a recovery-supported workplace to prevent addiction and lowers barriers for those seeking treatment and maintaining recovery. Always remember, there's always stigma when you use substances in our workplace. To create a recovery-supported workplace policy, they have suggest the following. We have to openly communicate the policies with every employees, train all supervisors and employees regarding these policies, evaluate the workplace to identify factors or hazards that may lead to substance misuse, promote a healthy work environment. We reduce the stigma, inform our employees of recovery resources, utilize an employee assistance program. Then we offer health and well-being programs. We offer all our employees to individuals in recovery. We identify and eliminate norms or rituals that promote drinking or drug use. Focus on the prevention of future employees misusing substances in the workplace. Okay, how do we prevent? Yan, we have to have provisions of recreations and entertainment in our hospital. Proper channelization of energies of the adolescents into constructive activities. We always emphasize health education, inculcation of the dangers of drug abuse of our students, teachers, and the families, increasing their awareness, provisions of periodic psychiatric guidelines, strict implementation of drug control measures, and measures for re-addiction. Effective prevention intervention programs consider cultural context, social resistance skills, and developmental level of their child. Skills training, teaching the problem and solving, teaching the problem solving and coping skills, development of a proper social and problem solving skills, treatment of their family problems or conflicts, increase opportunities for pro-social activities with their peers. Okay, we have primary, secondary, and tertiary program regarding substance abuse. A secondary level of intervention is early detection and counseling, brief intervention in primary care, motivational interviewing, full assessment, detoxifications. Then we have the so-called different kinds of groups such as Alcohol Anonymous, pharmacotherapy, and sometimes we use anti-abuse to prevent alcohol intake. And we provide counseling in our hospital and group therapy. Then pharmacologic use, yan. We have different kinds of pharmacologic substances used to treat substance and alcohol abuse. Then, the level of tertiary prevention includes alcohol deferred therapy, anger control, time management, dealing with cognitions. We are having these different steps in our hospital. Okay, then another form of treatment is rehabilitation of their substance use. Okay, for our role in the community mental health nursing and workers is the application of specialized knowledge to populations and communities to promote and maintain mental health and to rehabilitate population at risk that continue to have residual effects of mental illness. Community mental nursing or workers is different from our hospital setup. This is one of the advocacy setup we are trying to build in this hospital. The community settings requires that the psychiatric workers possesses knowledge about a broad array of community resources and be flexible in approaching problems related to individual psychiatric symptoms, family and support symptoms, basic living needs such as housing and financial support. And these are our attributes. We have coordination, understanding, knowledge, problem-solving skills, and the right attitude regarding awareness. Other ways are social skills training, which are occupational therapy, anxiety management, bereavement, group meeting, community outreach, child services, and adult and elderly care. Through this summary, though we have learned about substance abuse, factors affecting it, its prevention, primary psychiatric disorders, which is the complications of their substance use, its treatment, and the roles of our health workers in its advocacy. And for the conclusion, excessive use of alcohol, psychoactive drugs, and chemicals like volatile substances causes psychological disorders. In one particular country in India, 20 to 40% of subject age around 15 are current users of alcohol, and nearly 10% of them are regularly or excessive users. Nearly 15 to 30% of patients are developing alcohol-related problems seeking admissions in different hospitals. Here in our hospital setup or in our Department of Health, we always have the same statistical report. And thank you.